claims medical review is a collection of information and clinical review of the clinical chart prior to Philhealth sending. This is to ensure that claims preparation is made only for services that meet Philhealth coverage, accurate ICD or RVS coding, and medical necessity requirements. If done correctly, your hospital claims will not end up illegal. If done correctly, your claims will be paid. Hello, my name is Coach Doc Ben. I was a former Philhealth Claims Chief. I am the founder of UHC Clinical Claims Consultancy. So we teach hospitals how to decrease claims return, decrease their claims denied, and increase their Philhealth claims income. So if you are serious in Philhealth claims reimbursement, this video is for you. So if you stay till the end, you will discover that claims medical review in the hospital will potentially increase your income and prevent Philhealth legal problems. So if you think this topic is useful for you or for your hospital, and if you wish to know more on Philhealth concepts like the Claim Form 4, universal healthcare, no balance billing for private hospitals, please smash the like button and subscribe to this channel. So let us proceed. After all the allegations of Philhealth controversies during the last administration and during the current administration of President Duterte, it is not surprising that many hospitals have received letters from Philhealth legal office of their respective region, letters from the fact-finding investigation enforcement office, or letters from Philhealth prosecution office, and probably letters from Philhealth arbitration office. Now, in my observation, the previous Senate hearings, be it in the previous administration or the current one, resulted in the upsurge of letters, going out from Philhealth legal office to the hospitals. Now, I am sure many hospitals and many doctors are now being investigated on claims or cases that are 7 to 8 years old or even more. Either you or your doctors are asked to justify or probably have received summons. Now, I am sure many are confused, many are shocked, and I'm pretty sure many are frustrated. Now, based on my experience, these frustrating events can actually be prevented if the hospital instituted claims medical review prior to billing or prior to Philhealth sending. So, you may ask, why is there a need to do this? No. First, hospitals need to conduct their own medical claims review because Philhealth Claims Office conducts their own medical evaluation of the claims before payment. So you have Philhealth doctors review your claims, and of course, if there are inconsistencies in the claim, your claim will be denied or your claim will go to Philhealth Legal. Now, this is what they call as a medical pre-payment review. Now, second, if you have been following my videos, there is an overemphasis on the doctor's lack of awareness on Philhealth concepts. Now, this is true. Philhealth topics are not taught in medical school nor in residency training. Now, ironically, hospitals rely on Philhealth reimbursement, but hospitals do not invest in teaching their doctors on Philhealth rules. So, as a result, doctors in the hospital are prone to make actions that are inconsistent and non-compliant to Philhealth rules. So, your claims are not paid. Now, it may be common sense, but I have seen level 1, level 2, or level 3 hospitals that does not perform claims medical review prior to Philhealth sending. Now, many of my clients that instituted claims medical review in their hospital, review prior to Philhealth sending, have drastically reduced claims returned, reduced claims denied, and most importantly, had less problems with Philhealth Legal. So claims review is performed by a medical doctor. A medical doctor that is trained in Philhealth concepts, trained in Philhealth post-audit framework, and trained in Philhealth pre-payment review framework. So quite interesting, right? So, the claims medical review has the following task. First, the review of the physician's compliance in the clinical practice guidelines. As doctors treat patients, many of them see Philhealth rules and documentation as nuances. It's not their priority. So the clinical information on the chart is lacking or inconsistent. Now, in addition to this, the appropriateness of medical necessity to admit patient is not being followed by a handful of doctors. Patients are admitted because hospital census is low. So, these leads to denied claims due to non-compliance of the standard of care, or claims eventually is forwarded to Philhealth Legal. Now, I know several hospitals that are under investigation by Philhealth Legal and as well as under investigation by the NBI due to suspected upcasing of claims. So the clinical management basically does not match the final diagnosis. So claims medical review will prevent all of these. And at the same time, this will screen potential fraud done by certain individuals in your hospital. So the next task is review physician orders against actual services billed. So, again, most of the time, doctors focus in treating patients wherein many of them ends up with unnecessary health care. Basically, there is overutilization, or we can also say there is over-treatment of the patient. So this is when the healthcare services of your hospital becomes inappropriate. My friends, overutilization is a Philhealth violation. So claims medical review will not only identify overtreatment or overutilization in claims, but it will pinpoint the patterns and it will pinpoint the doctors who constantly do this. So your patients will appreciate this and your claims will be protected. So the next task is check the medication log to assure that the prescribed medicines were administered and matches the dosage that was billed. So, Philhealth prepayment review is very sensitive on clinical management. Now, you have the Claim Form 4, Part 5, very specific to drugs and medicines. Now, they require the strength, the dosages, the frequency, and even the prices of drugs and medicines that were given to patients. So, the claims review will ensure that proper medication was given to the patient based on the standard of care. At the same time, the claims review will screen non-formulary medicines. So, the use of non-formulary medicines in Philhealth is a minor offense. And the next task is review operative reports if they match the actual procedure done. Friends, this is one of my favorites. When I joined Philhealth about 15 to 16 years ago, if I'm not mistaken, operative reports were always a problem of the hospitals. So surgeons, either they do not make it, they do not sign it, or the surgeon makes a fraudulent operative report or an operative technique. So, most of the time, the claims are returned, and in many instances, the hospital ends up in Philhealth legal due to the doctor's actions. So, claims medical review in the hospital will screen the presence or the absence of operative technique. So, more than that, claims medical review prior to sending will check if the operative technique is the same as the actual surgery that was performed to the patient. This will prevent the upcasing of surgical claims. So this will prevent the denial of claims due to the non-compliance of standard of care. Now, these are just a few of the tasks of the medical review. Now, I can enumerate more, but this will take us days to finish. So in summary, if you are serious in Philhealth claims processing, you can prevent claims or your Philhealth claims going to legal, or you can prevent denial of your claims if your hospital will institute medical review prior to Philhealth sending. If you think claims medical review is an added expense to the hospital, please think twice. It is more expensive if your claims ends up in legal. So, if done efficiently, this will potentially increase your claims revenue. I hope you were able to get that. So if you like this video, tell me what you like about it. If you have specific claims topic you want me to discuss, just post a comment in the section below. If you want to learn more on Philhealth rules, if you want to learn more on Philhealth concepts, please subscribe in this channel. Friends, this is Coach Doc Pen. See you in the next session.